Our project submission number is 76 and the title is Reporting and Registering Domestic Violence Against Women and Girls in Colombia and Brazil. My name is Zinnya del Villar, Data Science Research Director at DataPop Alliance. Violence against women and girls has been referred to by UN Women as the shadow pandemic due to the ubiquity and gravity of the issue. Around the world, 1 out of every 3 women between 15 and 46 years have been physical and/or sexually abused by their partners. PAIWG can produce trauma, physical harm, and even death. In Latin America, one of the most violent regions for women and girls, it was estimated that only 12% of women officially report incidents of violence against them. This number varies per country. Underreporting, however, prevents us from understanding the life reality of women and dealing adequately with the ongoing violence. Unfortunately, the pandemic has only exacerbated pre-existing inequalities that have disproportionately affected marginalized groups, including women and girls. Lockdown measures like mobility restrictions or social distancing, as well as economic and social strains resulting from the health crisis, have been decisive in the consolidation of an environment where violence against women and girls has drastically increased in countries around the world. The United Nations Population Fund has estimated that the COVID-19 pandemic will likely reduce by 1/3 the advancements made towards ending gender-based violence around the world. But that's not the only way in which women were affected by the health emergency. Women and girls also had to bear additional consequences, such as overburden of household tasks, crowded conditions in place of residence, diminished decision-making power within the household, restricted autonomy in their reproductive and sexual health, shocks that may lead to financial dependence and economic hardships, and of course, the inability to escape situations of domestic violence. Considering these issues, we decide to leverage available sources of data to try to answer the following questions. Who does report domestic violence? What characterize these women and girls? Where are they reporting more? And what factors may enable or hinder this capability? For this analysis, we first conducted a pilot project in Mexico in partnership with JZ Data Lab, which was replicated in the cities of Bogotá and São Paulo between late 2020 and early 2021 with the support of the UNIDAS network. The goal was to map reported cases and identify factors associated with the capability to report and register domestic violence at the locality level. To do so, we first delineate a theoretical framework through a literature review that consisted of systematically reviewing 147 journals articles with a regional focus on Latin America and in 3 languages, English, Spanish, and Portuguese. We also conduct 12 semi-structured interviews with leaders and experts across 3 sectors, academic, public sector, and CSOs, to validate the findings from this research. Thematically, we first focus on determining what is understood as domestic violence and other key gender-based violence terms, as well as on clarifying what we refer to as capabilities. Finally, we looked at risk factors for PAIWG and the reporting of this violence. The term capability was introduced by the researcher Amartya Sen. In her model, she describes capability as a person's real freedoms to be what she/he would like to be and to do what she/he would like to do if they choose so. The capabilities are determined by functionings, which are the actual opportunities a person can achieve. These in turn are determined by environmental factors or the context. In that sense, capability, for the purpose of this project, makes reference to the opportunities provided by social and economic policies and programs to protect victims of GBV, which may facilitate or hinder the possibility of reporting and registering cases of domestic violence. In this way, The importance lies in the action of the state and not only in the agency of the woman who reports or doesn't report the incident. The capability to choose to act depends on the functioning, which is divided into two types, beings and doings. Beings is about a woman being informed about the different types of abuse that could be inflicted upon her, as well as the different types of service she could reach in case of experiencing such abuse. Doings is about having unrestricted mobility, a solid network for support, or any instruments that can facilitate the capacity of registering and or reporting experiencing violence. Functionings are determined and influenced by contextual conditions such as infrastructure and location. To define what constitutes gender-based violence, the literature presents a vast array of terminologies, and as such, it is important to establish a common understanding of its significance in order to properly identify and measure this phenomenon. Within the literature, commonly used terms as gender-based violence, intrafamilial violence, violence against women and girls, family violence, domestic violence, and intimate partner violence. This overlap allude to key difference in how the violence unfolds and who it affects. Gender-based violence consists of harmful acts perpetrated against a person based on the socially constructed difference that society assigns to men and women. It includes specific types of violence against men and boys and the LGBTI plus community and is often motivated by a desire to punish those who are perceived as challenging the gender norms. However, the term is used primarily to highlight the vulnerability of women and girls to various forms of violence. Violence against women and girls focus on physical, sexual, or psychological harm and suffering of women and girls. It is also associated with coercion or arbitrary deprivation of liberty. Domestic violence circumscribes aggression to the specific space of the household setting. It is important to note that violence against women and girls occurs amongst women from every age group, socioeconomic level, and place of origin all around the world. However, it is possible to discern key factors that make women increasingly vulnerable to experiencing violence and additionally, which factors may impact their capabilities to report domestic violence. The model adopted that incorporates the diverse factors in different categories was the ecological model because it provides a holistic approach to understand the etiology of gender-based violence through an integrated, multifaceted process referring to four categorical levels of analysis: societal, community, relationship, and individual. By developing the ecological model, our findings were divided into the following risk factor categories: personal, relational, community, and institutional. Furthermore, taking into account the current scenario of the COVID-19 pandemic, we decided that an additional category should be included to identify the factors that arose from the health emergency. Finally, some additional factors were identified that are transversal and navigate between each of these categorical spaces. In parallel with the theoretical framework, the research team conducted data collection efforts. However, accessing the needed data to complete the project is the biggest hurdle that we faced. When procuring data, the student came across three main challenges. Difficulty in assessing source of data. No data sources used for this project were open source or publicly available. The waiting periods regarding data requests to public institutions were long and process was incredibly strenuous and unintuitive. The second issue we dealt with was the lack of data standardization. Less than ideal temporal and spatial granularity and different across datasets. In some cases, insufficient sociodemographic indicators. Lack of homogenization and conceptualization of different types of violence, and lack of articulation of the information. These issues limit the model results and insights by reducing the level of comparability and interoperability between datasets. The last challenge is actually the same problem that the project itself tries to address under reporting. These issues produce a lack of sufficient information to accurately calculate rates of prevalence of violence against women anywhere. Undoubtedly, access to a greater amount of records as a consequence of higher levels of reporting would provide more and better insights regarding VAWG. These projects use traditional and non-traditional data, so important ethical and methodological issues were raised. To address this matter and potential concerns and questions, an independent Council for the Orientation and Development of Ethics, or CODE for short, was established from early on. The Code is an accountability mechanism that aims to ensure that the projects are relevant and appropriate to the context and that they comply with ethical principles. More specifically, it's an independent advisory and group composed of gender and data experts from diverse sectors, including international organizations, government agencies, and academic researchers. In this case, we organize a code with experts in Bogotá and one in São Paulo. Each form of approximately 14 members with whom we met 3 times via online throughout the duration of the project. With the code supports, a series of ethical principles were established to guide the development and deployment of the analytical model. This begs the question of what is the analytical model and what it consisted of. The analytical model we implemented in the project was composed of 3 stages. Stage 1, mapping the reported prevalence of violence against women and girls in Bogotá and São Paulo. Stage 2, identifying and measuring the impact of risk factors of the capability to report. And Stage 3, development of a data visualization platform. The objective of the first stage was to map the reported prevalence of domestic violence at the lowest level of spatial granularity possible to better understand that the reporting capabilities of women and girls by leveraging available sources of data covering reports of domestic violence. In Bogotá, we were able to gain access to 6 administrative databases with special granularity at the locality level. This city is composed of 20 localities. In São Paulo, we analyzed 4 administrative databases at the district or subprefectura level. This city is composed of 32 subprefecturas. In the case of Bogotá, since the beginning of the pandemic, there has been a significant increase in reports of domestic violence carried out through digital means and a decrease in reports that require physical presence, thus showing the impact of mobility restriction brought on by the pandemic on the reported rates of domestic violence against women and girls. Using this data, we also create a heat map to identify the different rates of reported domestic violence in Bogotá using a 4-tier color scale. For instance, if we only consider data for the first week of the pandemic in late March of the past year of the 20 localities in Bogotá, we could see that 8 fell in the lower end of the scale, meaning less women reported domestic violence. On the other hand, 2 localities were at the top of the scale, thus showing the highest levels of reporting. In São Paulo, the trend analysis of the 4 databases with reported cases revealed that while calls to emergency had an 18% increase between 2019 and 2020, crime reports regarding domestic violence showed a stark decrease of 27% in the number of complaints registered from March to July between 2019 and 2020. With results for the initial week of the pandemic in March 2020, we see 14 of the 32 cities subprefecturas showing the lowest rates of reported prevalence and only 1 subprefectura with the highest level of reports. However, I should remind here that we cannot equate reported violence with actual prevalence of domestic violence, given that a number of factors can influence the capability of women to report. I will now talk about some of the factors for which we could identify available quality data. For simplicity, I will refer to two cluster groups only: personal factors and contextual or environmental factors. In Bogotá, the personal factors associated with higher likelihood of reporting and registering of domestic violence were pertaining to the age bracket of women between 20 and 40 years old, being single, separated, or a widow, and having an heterosexual orientation. In the same sense, the most relevant contextual factors were not being a participant in the disarmament process and armed conflict or displacement. In São Paulo, the most significant personal factors was age. 20 to 49 years old women tend to report the most across the city, and the contextual factors most associated with reporting capabilities were cohabitation, women living in a space where 3-4 people share the same room, and access to support services, women living close to essential and non-essential services. It is important to emphasize that the results can vary locality by locality. The final stage is to launch an interactive data visualization platform that can serve as a tool for policymakers and stakeholders in NGOs and other organizations who work with survivors of domestic violence and benefit from a better understanding of the patterns of reports and the factors impacting this capability. With the analyzed data, the project has already important insights. Provides databases evidence to prompt authorities to design policies focused on incentivizing demographic groups with higher likelihood of underreporting to seek help and file a legal complaint or seek psychological and legal support. Reducing the potential impact of contextual factors that hinder the capabilities of women and girls at the locality level to report. Preventing the stigmatization of communities and individuals, targeting programs to reduce domestic violence to cities with low and high levels of reporting based on the factors associated with this capability. Finally, the project allowed us to explore and understand the gender data landscape, including the gaps and challenges within, from which we were able to outline a specific data policy recommendation. Increase the access to structured and quality open data and make the process for access requests more efficient. In terms of coverage and data disaggregation, increase the spatial, including rural areas, and time granularity, and include more sociodemographic indicators, especially disaggregated by gender, and homogenize the regulation between institutions. Regarding quality of data, improve the conceptualization of different types of gender violence to generate indicators that are used in an homogenized way by different institutions, and add identifiers to measure the incidence of victims that use more than one service in order to avoid duplicity. Finally, in the field of data governance, improve the articulation and interoperability of data between public institutions and civil society organizations, adopt ethical and data privacy guidelines while working with BIWG data, and promote a culture of evidence used to inform public policies for BIWG. Let's not forget that achieving gender equality requires quality, policy-relevant data. Without it, we cannot make informed decisions, monitor changes, and transform the lives of women and girls for the better. Thank you for listening.